Well, the COVID health emergency officially comes to an end in the U.S. on Thursday. What does this mean, and how will health care change?
Joining us as usual on Tuesdays, it's UW Health's Chief Quality Control Officer, Dr. Jeff Pothof.
Good to see you again.
Hello.
Hey, how are you guys?
Pretty good.
Doing well.
Pretty good.
Very good.
So, is COVID over?
Not over, but you know, we are in a lot better spot. I'm sitting on this couch talking to you guys when things are not looking so good. Cases are relatively low, so there's COVID out there. People are getting sick from COVID, but it does feel good to kind of have some of these things sunset and get back to managing COVID like, you know, other diseases, even though it's still relatively new.
Yeah, learning to continue to live with it.
Yeah, I think it's exactly that. It's, you know, it's not to say that, you know, we can completely forget about COVID right now. I think right now there is like a healthy amount of immunity in the community, either from previous infection or immunization. But it's important to know that as time goes on, that will start to wane. And without a lot of COVID out there, folks could find themselves in a situation where they don't have great protection against severe disease, which means, you know, when boosters become available, likely this fall, it will still be important to get them, even if COVID isn't making headlines.
So what does this ending of the health emergency mean?
I think, you know, it means a lot of different things to different folks, but for the average person out there, I think the important thing to be aware of is during the pandemic, it was really easy to get anything healthcare related to COVID-19, whether it was testing, vaccinations, medications. If you got sick, it was all covered, subsidized by the government. That starts to go away. So depending on your insurer, you may have more out-of-pocket costs for things like vaccination, buying tests, getting treatments if you do get sick with COVID. So like most other things, it's important to talk to your insurer and say, you know, what am I on the hook for? What am I not on the hook for? Don't just assume that it's all going to be free after this Thursday.
So it's probably important to start researching now so you're prepared, especially when fall, winter comes.
Yeah, I think absolutely. Or if you're running short of COVID tests, you know, see if there's any free tests still out there until folks run out, but then talk to your insurer. Some people could go to Walgreens, buy some tests. It was just covered. That might not be the case anymore. You might be paying for that yourself.
And they have expiration dates. Are those accurate?
Well, they're accurate when the test was manufactured, but what the test companies have been doing, working with regulators, is, you know, they got those tests out and we didn't really know how long they would last. So they put expiration dates on them. As those expiration dates get close, those companies are testing those tests to see if they're still good, and those expiration dates have been extended. So you can go on to, I believe it's a CDC website, it'll have the manufacturer and your lot number, and it'll give you like the updated expiration date. So don't just throw them out, look and see if they're still good.
Wow. Oh, I got a stack of them. I better check them. Been hoarding them.
Yeah. It's interesting to think 3 years later we're at this point.
Yeah, I mean, 3 years. Who would have thought 3 years?
But
I mean, I was hoping like 12 months, maybe on the high end.
But we did calls last week when you were here, and they're all COVID questions.
Yeah, I still think there's still a lot of COVID questions, or what's happening, and you know, should we be wearing masks? There's all kinds of stuff out there yet, but we are in a good spot.
We are. Good to see you, Dr.